Mom, my head hurts.
Wait a second, we should have something for that.
This is the third and final part of this home preparedness guide. In the first part, we talked about the physical basics: water, supplies, and the first 72 hours. In the second part, we talked about communication and the information that should still be available without the internet. Now we need to cover two things that are easy to ignore until the situation becomes serious: carbon monoxide risk in closed rooms and the first aid kit during outages. These topics are not about panic. They are about preventing quiet mistakes when people are tired, cold, stressed, or acting in the dark. Because in a long disruption, safety is not separate from preparedness. Safety is part of the plan. During a blackout, the danger is not only being left without heat. The danger is starting to heat the home with something that was never designed for that purpose. When an apartment is cold, the lights are off, the radiators are cooling down, and there is a child, an older person, or someone who does not tolerate cold well. People want an immediate solution. Turn on the gas stove, use a camping burner, bring a heat source closer, use a charcoal grill, use a generator, or improvise with a homemade heater. At first, this can look like practical household thinking, but inside a closed space, this kind of improvisation can become a deadly risk: carbon monoxide poisoning. The main problem with carbon monoxide is that you cannot detect it by your senses. It has no color, no smell, and no taste. It can bind to the blood and block normal oxygen delivery to the body, and the dangerous situation can develop quietly. A person is only trying to get warm, or cook food, or turn something on for just a few minutes. That is exactly why this plan cannot be built on dangerous compromises. I will open a window, only for 5 minutes. I will watch it carefully. The generator can stand on the glazed balcony. The stove will quickly warm the kitchen. During a long outage, these decisions are not always made because people are careless. They are often made because people are tired and cold. But the risk does not become smaller. The first rule is simple. A gas stove or oven must not be used as a heater. A stove is for cooking food, not for heating the home. Cooking during a blackout should be short, controlled, and done with ventilation, a slightly opened window, and constant attention. Do not leave gas appliances running just to warm the room. That is not a heating plan. That is a risk. The second rule is even stricter. Devices with open combustion or internal combustion engines must not be brought into closed spaces. Camping stoves, burners, charcoal grills, coal braziers, kerosene heaters not approved for indoor use, gasoline or diesel generators. Do not use them inside apartments. Do not use them inside private homes. Do not use them in basements. Do not use them in stairwells. And do not use them on glazed balconies. For portable generators, the safety rule is clear: only outside, in open air, at least 6 meters or 20 feet away from windows, doors, vents, and openings, and with the exhaust directed away from the home. Also, never refuel a hot generator, let it cool first. Fuel spilled on hot engine parts can cause a serious fire. The third rule is a carbon monoxide detector. Every home should have one. This is not a luxury item, it is a basic safety device. Choose a battery-powered detector or a model with a long-life built-in battery. Install it according to the manufacturer's instructions, usually away from drafts and not too close to gas appliances. Test it regularly with the test button, replace the batteries when needed. And remember that the sensor itself has a limited service life, often 5 to 10 years depending on the model. After that, the device must be replaced. The fourth rule is that safe warmth starts with passive insulation, not fire. First, reduce heat loss and warm the people. Do not try to heat the whole apartment. Use layers of clothing, thermal underwear, one small warm room for the family, closed doors, reduced drafts, blankets, sleeping bags, foam mats or rugs on the floor, and hot drinks from a thermos. Warming a person is much faster, simpler, and safer than trying to warm all the air around them. The fifth rule is that hard bans should be agreed by the whole family in advance. Do not use the stove for heat. Do not bring a generator indoors. Do not use charcoal or grills inside. Do not leave a camping burner unattended. Do not use a burner as a heater. Do not experiment with homemade heaters or candles placed on plates. In a critical moment, these rules should not be debated again. They should be automatic. It is also important to note the warning signs of carbon monoxide poisoning: a dull headache, dizziness, strong weakness, nausea, vomiting, shortness of breath, fast heartbeat, confusion. The symptoms can look similar to the flu, but often without fever. If these signs appear while fuel burning or gas appliances are being used, act immediately. Open doors and windows if you can do so safely. Move everyone to fresh air. Call your local emergency number. And do not return to the space until it has been fully ventilated and the source of the danger has been removed. The purpose of preparing for cold during a blackout is not to find heat at any cost. The purpose is to stay warm without creating a deadly threat. Safe heat is built on simple decisions after which the home and the family remain safe. During a long blackout, a first aid kit is not about having more medicine at home. It is about not searching, not guessing, and not making mistakes at the exact moment when something is needed. The problem with many home first aid kits is that they exist only formally. Some medicine is in the kitchen, some is in the bathroom, some is in a bag, something is left in an old package. An instruction sheet is missing. Something has already expired. And personal medication may be stored separately, without a clear label, without dosages, and without a reserve. When everything is calm, this feels like a small household inconvenience. But during a power outage, the situation changes. The internet may be unstable. Pharmacies may be closed or working with limits. The apartment is dark. The phone battery is running low. A child may need medicine. An adult may develop a fever, pain, stomach trouble, or a minor household injury. And at that moment, a chaotic first aid kit becomes not help but an additional risk. A proper first aid kit for outages is not a huge home pharmacy. It is a clear system for the first days. What you have, where it is, who can use it, and how quickly it can be reached. The first section is basic supplies for common household situations. It should include only the things your family actually knows how to use. Medicine for fever or pain, stomach medicine, oral rehydration solution, and approved sorbent. Antiseptic, bandages, sterile gauze pads, gloves, scissors, and a thermometer. The point is not to buy random medication just in case. The point is to cover the most common simple situations without panic and without improvisation. The second section is personal medication. This is the most important part. If someone in the family regularly takes prescription or life-critical medication, it should not be stored randomly. It is better to keep it separately with a clear label. Who it is for, when to take it, what dosage to take, and where the reserve is stored. Do not rely on being able to quickly find a prescription during an outage. Do not rely on opening an app. Do not rely on reading instructions online. And do not rely only on memory. If a medication is needed every day, you should build a reserve for at least 7 days. Ideally, 14 to 30 days if your doctor says this is appropriate for your situation. Many emergency preparedness recommendations treat a 1-week reserve of essential medication as a minimum for an emergency kit. Discuss this buffer with your doctor. This is especially important for older people, people with chronic conditions, and any situation where missing a dose may create a serious risk. The third section is the child section, if there is a child in the family. Children's medicine must be clearly separated from adult medicine. Here, age, weight, medicine form, and dosage are especially important. Many pediatric liquid medicines are dosed by weight, not just by age. That is why it is better to keep a paper sheet nearby with the pediatrician's instructions or pre-written allowed actions for typical situations. Not for experiments, but so that a stressed adult does not make decisions at random. The fourth section is wound care and minor injuries. A cut, a minor burn, a scratch, a scraped knee, skin irritation. These are not rare when people move in the dark, use flashlights, cook in unusual conditions, or take things from boxes and cabinets. That is why bandages, plasters, gauze pads, antiseptic, gloves, and scissors should not be scattered across different places. They should be stored in one clear pouch. The fifth section is storage. The first aid kit must be accessible in the dark. A bad place is a humid bathroom. Moisture and temperature changes can damage many medicines faster. A bad place is also a high back shelf, a box behind other things, or a drawer that only one person in the family can open. A better place is a dry, cool, and obvious area of the apartment, near the blackout box, or in a place you can reach without a long search in the dark. Inside the first aid kit, use small pouches or sections: fever and pain, stomach issues, wound care, personal medication, child supplies. Then you do not have to dump everything onto the table and search under weak light. The sixth section is instructions. In medical situations, relying only on memory is dangerous. One sheet of paper can be more useful than 10 packages. It can contain the list of personal medications, basic doctor instructions, important contraindications, contacts for a doctor or clinic. and information for a child or an older relative. This sheet should physically stay inside the first aid kit, not only in the phone's memory. The 7th section is checking. Once a month, quickly check expiration dates, the thermometer battery, the supply of plasters, gloves, antiseptic, and personal medication. Separately, check medication that requires strict temperature storage, such as insulin. If the refrigerator loses power, these medicines need a separate plan. An insulated medical bag, portable cold packs, and a clear understanding of how long they can hold the required temperature range, usually between 2 and 8 degrees Celsius, if that is what the medication instructions require. The main goal of this first aid kit is not to treat everything at home. The main goal is to avoid losing the first critical minutes, to avoid mixing up medications, and to avoid being without the things your family truly needs. During a long blackout, order matters more than quantity. A first aid kit should answer 4 questions. What do we have? Where is it? Who can use it? And what must be checked in advance? When these answers are clear, the first aid kit stops being a random box of pills. It becomes part of home autonomy, just as important as light, water, communication, and documents. A home preparedness plan is not finished when you buy a few supplies. It works only when the basic resources are ready, the family knows how to communicate, important information is available offline, and the most serious safety risks are not ignored. Carbon monoxide is dangerous because you cannot rely on your senses to notice it. A first aid kit is useful only if it is complete, accessible, and understood by the people who may need it. The goal of this series is simple: less chaos, fewer dangerous improvisations, and more clear actions when normal systems stop. I wish you and your family safety, health, and calm decisions in difficult moments. Stay safe, stay prepared, and stay connected with the people close to you.